And what is the outcome of the surgery? It is 100% that it will be fixed. The problem gets fixed.
Yeah. So what happens is these ligaments, once they are torn, they are like rubber bands. They come apart. You cannot re-stitch them back again. They will not get the same tension back. Once they're torn, once they're touched it. Unless they are coming avulsed from the bone, then you can fix it. But if it's torn in the middle, like a mixed substance tear, it's like a rubber band cut in between, then there's no use repairing them or stitching them back. They don't work. So you will have to reconstruct. That means you take something else to replace that. And that's where you end up with a graft system.
Okay.
So you have either an allograft or an autograft. Autograft means we use one of the hamstrings or there are quite a few tendons which we can use in the body to replace that ligament.
Okay. And the one that you replace after a surgery is as good as the old one?
95%, I would say. I would never say 100% because you're still trying to replace this. It's never going to be bad, but 95% they get back to the normal function.
Which is minus of sport. Oh, sports person can go back.
Yeah. They will go back. All the sports person who have an ACL injury will have to have surgery done. And they go back to playing sports.
Wonderful. But how is it that I hear that so many of the sportsmen, not the professional levels who can afford a doctor of your class, but then others who go to other doctors also come back saying surgery didn't solve their problem, it got from bad to worse. What does happen when...
Few things happen. See, you need to know, you need to get the right diagnosis. Whether you have a menace. Second, the repair or whatever the reconstruction should be done properly. If it's just not done properly, it will not work. We'll still have the laxity back again.
Okay.
For the instability. So surgery is essential, but surgery should be done properly. If
right.
So surgery, unless everyone starts doing it, we just seen one case, you start doing it, you may not be able to be good at it. Initial few cases may not give you good results. So those patients are not going to be happy. But the more you do, the more you get better you get it.
Right.
So training also helps in that.
Sure. And so in case a surgery is botched by a surgeon, then is there a second chance for the patient with some other surgeon?
Yeah, you can. We do revise it, but the problem is you do a second surgery, it's called a revision surgery, but they're never going to be the same as the first time.
Okay.
The outcomes will never be as good as the first time. So when you do the first knee or the virgin knee, which we call it, when you do it first time, if you do it right, it works well.
Okay.
If you make a mistake, then you want to go back and correct it second time, it doesn't work as well as that. But still, yes, you would have to do it if it's not properly done. But the results they don't be 100%. I would say not 95%, they'll be probably 80 or 85%.